Our group conducted a lit search summary on the use of incorporating pet therapy into the treatment program of college students struggling with anxiety and depression. Anxiety and depression have a high prevalence in college students due to the increased amount of stress from academic demands. We asked the question, in college students struggling with anxiety and depression, how does incorporating the use of emotional support animals into a treatment plan compared to taking only pharmacological therapy affect the incidence of panic attacks and depressive episodes? Research concluded that those with mental health problems were shown to have a much harder time coping with academic demands and wondered if the college experience was worth it. Counseling services with a 1-to-1 ratio were found to not be accessible at many universities, leading to increased loneliness and reluctancy to express emotions. It was also found that interactions with animals causes the release of serotonin and endorphins while reducing the secretion of stress hormones, which results in a decrease in physical symptoms and promoted a positive mental status.
We developed an evidence-based practice project using the Plan, Do, Study, Act framework, also known as the PDSA cycle. During the planning phase, we will establish a team including mental health counselors, psychiatrists, and social workers. Then we'll evaluate the current problem, which is that college students are under an immense amount of stress to complete academic work as well as produce work that is exemplary. As a result of these stressors, students are often forced to face feelings of anxiety and depression, which manifest in panic attacks and symptoms of decreased self-worth. Our aim statement will be incorporating pet therapy into the treatment plan of college students who experience anxiety and depression to decrease the amount of panic attacks and depressive episodes compared to the use of pharmacological methods alone. This will be achieved using a convenient sampling study of college students. Students will be asked to take part in pet therapy and provide demographic data. Prior to and after pet therapy, students will fill out a rating scale of their symptoms related to anxiety and depression. The outcome we expect to see is that there will be a larger decrease in anxiety and depressive symptoms in those who take part in pet therapy and take medication compared to those who only use pharmacological methods.
During the due phase, we will first submit our project to the IRB due to students being a vulnerable population and the risk of allergies to pets. Once approved, we will gather 500 college students at Greendale University and have them sign a consent form stating the purpose of the study, medication risks, the extent of time the study will be conducted, contact information, and notification that this is a voluntary study. Participants will be then asked to sign up for pet therapy sessions. Prior to the session beginning, participants will be asked to provide demographic data, including their gender, age, if they are currently taking any medication for anxiety or depression, and if they own pets or regularly spend time with animals. Participants will then fill out the Hamilton Depression Rating Scale, which contains 17 questions relating to symptoms of depression experienced in the last week. Some of the questions include depressed mood, feelings of sadness, and thoughts of suicide. Participants will also fill out the Hamilton Anxiety Rating Scale, which consists of 14 questions relating to symptoms of anxiety prior to pet therapy. Some of the questions include anxious mood, insomnia, and difficulty concentrating. Participants will then be recommended to spend 30 minutes with the animals and will be asked to fill out the same rating scales following their session with pet therapy.
In the study phase, we would expect to find that participants who took medication for anxiety and depression prior to attending pet therapy but did not own a pet or regularly spend time with animals reported a higher rate of a decrease in symptoms compared to those who did not take any medication but did attend pet therapy. We would also expect to find that participants who took medication and had regular interactions with animals would report a higher decrease in symptoms compared to those who took medication but did not have regular interaction with animals. This could be because regular exposure to animals would allow the brain to constantly produce serotonin and endorphins. We would also expect to see symptoms of anxiety and depression decrease in those who did not take medication and or do not own a pet. However, the difference between before and after pet therapy may not be as drastic as they do not have increased intervention or medication. Overall, we would expect that the outcome would be that those who attended pet therapy and take medication are more likely to report a decrease in anxiety and depression ratings and symptoms compared to those who only take psychotropic medication.
During the ACT phase, we'd encourage other colleagues to include pet therapy in their counseling programs and allow students to visit with them at any time in a safe and comfortable environment. It would also be beneficial to research companies that have on-the-go pet therapy programs that could come to college campuses at scheduled times. By understanding these effects that pet therapy has on college students who are experiencing depression and anxiety, college administration can better implement counseling services that have a positive effect on their students and promote their overall well-being. Using pet therapy could encourage students to seek help for their mental and physical health in a comfortable and safe environment. Overall, the use of pet therapy may be able to promote mental well-being in a vulnerable population, such as college students.